welcome back, everybody. You know, on August the 24th, the Association for Vascular Access, they're going to be holding their network dinner in the Bronx, and joining us with all the details, we have Jonah Caparis and Stephanie Light. We welcome you guys to the show.
Thank you so much for inviting us.
Vascular Access, explain.
Well, vascular access.
Or do you need my arm?
Well, yeah, it's in plain language, it's a tube that's placed into your vein, and central lines are placed into your major vein, such as above your heart. That central vein above your heart, they're called superior vena cava. There are about 5 million central lines placed in the U.S. alone, and 25% of them, die from infections, and it costs about up to $40,000 to treat these infections. 70% of those who gets infected are preventable. Anyway, so the purpose of our network, the Association for Vascular Access New York Network, is committed in promoting awareness of vascular access care and care maintenance to promote patient outcomes. So we facilitate evidence sharing education through presentations, innovative presentations such as this one that's upcoming.
I'm more educated now about it. But who would need some vascular treatment or whatever?
Well, actually, it's virtually everyone who are coming to the hospital gets an intravenous catheter. So we are more on the vascular access devices. The national AVA, the Association for Vascular Access, is a organization of healthcare professionals, and we partner with manufacturer of medical devices and do research and provide evidence-based practice to keep our patients safe.
Yeah, and Stephanie, she mentioned infections. How do those infections occur for something that's been in for a long period of time?
So when these vascular access devices are placed in patients, there are multiple caregivers that are accessing that device to give them medication. So every time you open up that tube to provide chemotherapy or any kind of medication you need, it's a source where bacteria can get into your bloodstream.
So you have to wipe it off with alcohol.
Exactly.
And have the gloves on. And
have the sterile gloves on, have a mask on so you're not breathing into the access site.
Yeah.
All those sorts of things.
Whoever's touching those lines are washing their hands. There's certain time when you wipe the hub of the access, wipe it for 15 seconds. And it just doesn't took about 10 washing. There's a standard and guidelines in how to insert this line. So Dr. Ledone is going to come and talk about the care and maintenance of a line. It starts from proper way of inserting it and how you insert it and where you insert it and how you dress it so it's easier for the nurses to care for the lines and keep our patients safe.
Yes.
We don't want them getting infected. It costs about $40,000. It prolongs up to 10 days stay. And it costs about billions of dollars in healthcare costs.
Yeah.
So, that's why we're so into this research and evidence-based sharing practices. So that's what we provide education to healthcare professionals.
Yes.
So we do our meetings every other month, usually at a restaurant. So we provide 2 CEUs to also help the nurses keep their certifications in every areas of nursing and medicine. We provide CEUs to keep their certifications as well.
How long are these stints? Maybe I'm saying it wrong. How long are they? How long do they stay with the patient? Because it seems like it's a while if it's creating an infection after a while.
Well, that's why it starts from the proper assessment of the patient based on the diagnosis, how long they need the line for, and if the line is not needed, they have to come out. They should not be idle there and collecting infections.
Do you also deal with the lines that some people have feeding tubes? Do you also deal with that type of line?
Well, they could also, no, that's a little different.
It's different.
Basically, ours are any
Just vascular.
line that goes into a vessel, into a vein,
Yes.
where you could get your antibiotics, your hydration, your nutrition.
Right.
Right.
Stephanie, we have something coming up that will.
Yes,
Tell
we
us
do.
about
We have an
that.
event coming up next week. It's on August 24th. And like she said, we host a dinner event at a restaurant, and then we have a couple speakers come. And next week we have Dr. Ladone coming, like she said, to talk about care and maintenance of catheters. And then we have an additional speaker as well. And this will be held in the Bronx at Jimmy's Grand Cafe.
Oh, yeah.
Yeah, it's, I believe, newly opened. Or
Yes, yeah.
Yes, so we're very excited to see the new restaurant and experience the food there, and have some wonderful education as well for our nurses.
Yes, yes. And I think, you know, you guys are creating awareness for the public also. But this is mainly for the nurses to educate themselves on how to take care of those things that
central
are
lines.
inserted, right? Make sure you wash your hands. Make sure
They flush it correctly. so
flush
they
it
don't clog up.
correctly.
They change the dressing.
You wipe it for more than 3 minutes, or is that too long?
15 seconds.
15 seconds with an alcohol swab, or wear your gloves.
Wear your gloves.
Where
wash
can
your
we go for
hands.
more information on what you guys are doing?
We have our website, www.avanewyorkmetro.com. And if you want to attend I encourage you to attend our CE dinner. Click on the calendar of events. We have the events scheduled there.
Okay.
So you could, if you cannot come on August 24th, there's also future events.
Yeah, maybe we can get some BronxNet cameras over there. Let's
Oh,
talk.
thank you.
Stephanie Light and Jonah Caparis. Give them a big round of applause, everybody. Stay right there. We have to take a quick break, but stay tuned. We'll be right back with more Open next.